Welcome, Dr. Brett Gilbert here. This is another episode of 3 Questions with Dr. Brett Gilbert. I'm very excited to be with you today. I have another guest that's going to be joining me. The guest today is a wonderful endodontist out of New York City, Dr. Stephanie Tran, and I am extremely excited to welcome her on and ask her the 3 questions. So if you've been following me the last few days, establishing a little segment here with the intention of sharing some of the brilliance of some of my colleagues, both within endodontics, within other specialties of dentistry, and being able to have everyone come on and just talk about what inspired them, how did they get involved with dentistry, how did they get inspired to become the great clinician and doctors that they are. And so I'm really excited today to be able to welcome another guest. I was the primary guest on Friday. Yesterday, I was very lucky to have Dr. Gary Glassman join me. These episodes are archived in my IGTV channel, so you can check them out there. And so now I'm just waiting for my guest today, Dr. Stephanie Tran. She's known on Instagram as Her Holiness the Pope, and she has a great channel. She posts amazing cases. Really fun to follow her and all of her progress in endodontics. So just want to get her invited in here as soon as she joins us, and then we will be able to ask her the 3 questions. So I hope you guys are having a great Sunday and ready to do a little bit of dental talk, because as you know, endodontists are endo 24/7. And so here we go. So let's see if Dr. Tran will join us and we can get her on here. So here she is. Let's send her an invite and see if she is ready. So in regards to endodontics today, we really are so focused on using our technology to be able to do the very best job that we can. We have amazing instruments and microscopes, incredibly flexible files and instruments that allow us to go deep into the canal spaces, whether they're curved or what have you, maintain the natural anatomy, and be able to really do a wonderful job. Our disinfection protocols have increased and improved so much with some of the newer technologies on board to get irrigant delivered deeper and better all the time. So let's see if, here she is. Let's see if we can get her invited. Let's see if Dr. Tran will join us and go live with Dr. Tran. Let's see if she's ready. Okay. Let's see if Dr. Tran is ready to join us for 3 questions with Dr. Brett Gilbert. Hello, how are you?
Hi.
Welcome. So nice to see you.
So nice to see you as well. Thanks so much for having me, and thanks for everyone for joining us on Instagram Live.
Yeah, so fun. Such a cool way to connect and share, and so I'm so excited you're able to come on. For those of you who don't follow Dr. Tran, one thing about her feed that I just love is she eats at the most incredible places and photographs it all so well that it just literally makes your mouth water. So I saw your dim sum earlier today, so looked amazing. So,
yes, have you ever had dim sum?
I have, but that really looked like it was like top-notch dim sum. So
oh, it was great. It was like a perfect little hole in the wall place that a friend of mine had recommended. So next time you're out in New York, I'll definitely have to show you best places.
For sure.
Right?
No, I definitely want to join you to dine because I love how you brunch. So, so Dr. Tran is here on a Sunday afternoon. I'm so grateful for you joining us. So this is 3 questions with Dr. Brett Gilbert. And question number 1 for Dr. Tran is, what we want to know is, what was that moment, that sort of wow, aha moment where you said to yourself, I want to be an endodontist? Can you tell us about that?
Yeah, that's a question I get a lot. Like, how do I know about endo? I think definitely the precipitating moment was when I was in dental school. One of my first patients ever. I was a brand new student doctor, first time in clinic. One of my first patients, and one of the nicest patients I'd ever had was a cab driver that I'd met, and I handed him my card, and turns out he had a toothache, and it was actually one of my first procedures too in dental school, to do a root canal on a premolar of his, and he was so nice. It was and I really felt like it was really rewarding experience, because the cusp of endo is to help people get out of pain. We're helping save their teeth. And it was a gentleman who was so nice. He hadn't been to a dentist in like 15 years, but he decided he wanted to come, and he was my patient. He was one of the best patients I had in dental school. So that made me definitely consider it, because I was really lucky going to UOP, great school, and they had a really strong restorative program as well. Like, you know, we see a lot of the general dentists and restorative dentists on Instagram who are from University Pacific. So for a while, I thought maybe I would go into restorative, and I went into a GPR, and that helped make me really consider, you know, I think maybe endo would be definitely the specialty I would go into. I finished dental school. I mean, I'd always loved endo, and that moment in dental school made me really consider it like seriously. But it wasn't until after I got more experience in both a GPR and private practice as a general dentist that I was like, I really love all the aspects of endo. And it's not just the root canals aspect. I think everybody thinks that all we do is root canals, but there's so much to it. It's understanding the, you know, biology of it, microbes, infection management, trauma management. That's a big one. And those were all things I actually did a lot of when I was in GPR and as a general dentist. And those experiences helped really solidify that I wanted to do endo for sure. And that's why I went back into endo after practicing for a bit.
That's so cool. Yeah. And for those that aren't dentists that are joining us, so endodontics, the specialty of root canal treatment. If you hold a huge population of dental students, they might actually tell you that root canals or endodontics is the thing they want to do the least of, because it's fraught with challenges, and it's really an incredibly challenging and intricate procedure. So those that do specialize in it have a real passion for it, as you can tell. And so leading into your passion, the second question